thank you all for attending this. Really appreciate it. I know that some of you have, we've heard about pandemic fatigue. Now we're hearing about webinar fatigue. So I will try to keep this moving and as interactive as possible. So in order to do that, what I wanted to demonstrate today was that we developed this e-tool such that it's a downloadable, readily modifiable, flexible tool to help farmers develop requisite pandemic preparedness plans and think about the possibilities or the hazards specific to their operations for spread of COVID and how to work towards mitigating spread in their operations. So the CHAMP acronym stands for the COVID-19 Hazard Assessment and Mitigation Plan. It was developed by a team of extension educators and myself from Michigan State University. Our goal in doing this was to provide information, well, I guess twofold, was to provide information to the ag business owners and operators that was up to date, real time, let you know what's happening with COVID at the moment, what are the requirements to assist with mitigating spread amongst the workforce, as well as for those public facing operations, how to help protect your workers from the public that may have COVID. So anyway, we opted to do this. This is called the CHAMP Lite e-tool. We are working towards developing a web-based downloadable and mobile app as well. So stay tuned for that. So this e-tool was developed initially as a within Excel, because most people have access to the Microsoft suite of tools, and we developed it as a workbook. And so each tab along the bottom of the Excel workbook represents a different component that is required within pandemic preparedness planning. So I'm not sure if any of you are from the state of Michigan, or if your states require businesses to have a written pandemic preparedness plan in place, but our state does. And so the goal here was to, again, as I mentioned earlier, not only provide information that is real time and updated, but also if the owner operator so chooses, as they walk through each of the worksheets within this tool and complete the forms, by the time they get to the end, they will have a documented, printable pandemic preparedness plan. So what are the requirements, or what's happening with COVID right now? So there's a brief description up at the top of this first tab, which is the COVID-19 preparedness plan requirements, that describes the virus, gives a little bit about a background as to when the initial requirements for implementation of health and safety practices aimed at mitigating the spread of COVID came into place. Talks a little bit about how that morphed over time or changed over time. In our state, originally, these orders came through executive orders. They're now a requirement through the Michigan Department of Health and Human Services epidemic orders, and have components, required components as administered through the Michigan Occupational Safety and Health Association, or MIOSHA, workplace rules. So for Michigan, this requirement, as far as I'm understanding right now, will be in place for an extended period of time, perhaps even beyond COVID. So again, this can be modified to be specific to your state pretty easily. And again, as I mentioned earlier, completion of this workbook will set you up for compliance in having a pandemic preparedness plan in place. So as with all Excel workbooks, these are readily modifiable. This worksheet has placeholders where business owners and operators can enter their business information, including contact numbers and addresses, as well as there's a placeholder for pandemic preparedness responsible individuals and their contact information. So along the right side of each of these worksheets, there are hot links that could be of interest to users. So for example, we have links to enforcement. So who's going to enforce these requirements, the OSHA COVID-19 standards. So if you click on that, up will pop the OSHA website talking about what regulations and those specific to COVID-19. We also have state-specific requirements along the right side of the screen as well. So the second tab has to do with health screening. So as we all know, screening prior to an employee entering the workplace is the best means of preventing spread through the workplace. If we can catch some of those symptoms and keep people at home, that's the best way that we know to prevent spread. So again, there's an informational blurb at the top of the screen. So this has to do with screening strategies. So daily health screenings are required, including checking temperatures using a non-contact thermometer. There's a discussion about current CDC and US Department of Labor interim guidance aimed specifically at agricultural workers, and that suggests they implement the following. So again, it talks about the requirement to screen workers prior to entering the workplace. Screening, whether performed verbally or through the use of a written form, must be done in a language suitable for the employee. Entry must not be permitted to those that are reporting symptoms or with a fever. It talks about facilitating the need to facilitate communication between workers and supervisors, such that if our workers begin to feel ill during the day, they know who to go to, and more importantly, they feel comfortable going to a supervisor and discussing their symptoms. Businesses need to develop a plan to quarantine and manage sick workers. So for those who begin feeling sick during the workday, individuals need to be trained as to how to protect themselves, including the correct use of personal protective equipment if they're supervising employees who begin to feel ill. And then also there's a need to establish check-in procedures, ensuring adequate spatial distancing, providing hand washing stations and so forth. So for those entities that are interested in having employees come in and fill out a daily check sheet, all you have to do, this is a printable form. You can click on this form, it downloads, you're able to print it and have several on hand for your employees to complete as they enter the workforce each day. And if you so choose, we also have an interactive screening form that can be downloaded and submitted via mobile phone or computer emailed by computer prior to your employee leaving for, or your workers leaving for the job site each day. These have also been translated into Spanish, and we're in the process of translating these screening forms into other languages as well. So stay tuned for that. Those will all be posted. We have links, again, hot links along the side of the worksheet. So the first one that I clicked on was that interactive screening form that I just showed you. The second is for the Federal CARES Act, who's eligible, how you get that set up. Where are their testing sites? What are the return to work guidelines? So if you have individuals that have tested positive for COVID, when can they come back to work? The next tab has to do with preparing your workplace. So what are the requirements, cleaning and disinfecting requirements in the workplace, and how do you go about setting up a written program as part of your pandemic preparedness plan? So again, just as with the other worksheets, at the top of each screen, there is a bit of background information. So we discuss how to evaluate your facility and specifically the jobs and tasks where workers in the public may come in contact with, and to determine the types of surfaces that are present and that may need to be cleaned. So we give some examples of frequently touched surfaces like time clocks, doorknobs, excuse me, restrooms, any shared tools and equipment. If you are on farm and have shared vehicles like trucks and tractors, gators, etc., those will need to be frequently cleaned and disinfected. We talk about the fact that in order to disinfect a surface, you must clean it first. So we discuss strategies in doing that. So for example, first clean the surface with soap and water because the disinfectant can't get to the surface itself if there's a film or a layer of dirt or debris on top. Then you need to select an EPA approved disinfectant. And so we have hot links that will take you to, I can get it to work. Well, it works over here. The EPA's N-list disinfectants for coronavirus. So if you're interested to know what those are, you can find them. If you don't have the ability to access an EPA approved disinfectant, which I believe this was more of an issue early on in the pandemic than it is now, it's difficult to source those materials. There is instructions as to how to using materials available to you, like just simply bleach and water, how to mix up a suitable disinfectant mixture with disinfectant properties that are known to be able to kill COVID. So here we talk about using a 1/3 cup of bleach added to a gallon of water, or you can use a 70% alcohol solution to disinfect. We also make mention that it's very important not to mix bleach or other cleaning and disinfecting products together because there may be a chemical reaction that can be pretty dangerous. So we talk about also the need to train individuals who are required to do or on the hook to do the cleaning and disinfecting. Make sure that they know how to safely use the disinfectants that have been determined acceptable for use in your facilities. Provide appropriate PPE if necessary. That may be splash-proof goggles. That may be special gloves. And then also employees need to be trained as to how to safely discard PPE rags or paper towels that have been used to wipe down surfaces and so forth. We've talked about where and how and if surfaces in outdoor areas on farms need to be disinfected. So generally, and again, some of this was more specific to activity that was going on earlier in the pandemic when we didn't really know as well how COVID was transmitted and how readily you'd be able to pick up COVID from touching surfaces. But initially, there was talk about disinfecting sides of buildings as well as walkways. We absolutely don't need to go to that extent at this point. Again, that may change in the future depending on the variants that are new, but as of right now, just following CDC guidance for cleaning and disinfecting should be sufficient. We have an example of a sanitation protocol. So this is one that is utilized, could be utilized for a break room. So it describes frequency, how often for your facility, for your operation, should cleaning and disinfecting be scheduled? Whose responsibility is it? And then again, instructions, as we talked about earlier, as to exactly how to perform those cleaning and disinfection procedures. So washing hands, putting on personal protective equipment, removing trash and debris from an area, wiping down surfaces, and so forth. And again, because this is Excel, you can modify these requirements or procedures, I should say, protocols for your facilities. And you can simply copy and paste this as many times as necessary to cover all of the areas in question. So for example, this was a break room. You would need one for restrooms, for rooms or areas where common tools are being used or common surfaces being touched. If you have a public facing operation, front of the house locations like counters and credit card readers and those types of surfaces. We have facilities that have group housing operations. And so with group housing, you're required to set up bunks in such a way to minimize spread or dispersion between workers. There are checklists and modifiable printable tools that can be used to help make sure that you have plans and procedures in place such that if a worker tests positive for COVID, how do you adequately or sufficiently quarantine that employee, that worker, and care for them while they're sick? And not only provide adequate or proper care for those workers, but also to keep the other individuals that are living within that shared housing unit safe from contracting COVID. So again, we have quick links over to the side. So CDC guidelines for agriculture workers and employers. Some of this gets at group housing situations, as well as, again, we have these printable checklists and plans, both in English and in Spanish, that talk about how to establish your group housing situations or group housing facilities, as well as sort of daily and weekly audit schedules to make sure that everything is operating correctly. We do have the requirement in Michigan that in certain ag type operations, so for example, those that have owners and operators of group housing, as well as certain commodities like greenhouses, meats processing facilities, those types of things. Any operation that has 20 or more workers on site at any one time, seasonal employees, those types of things, we do have a testing requirement. And so there are links available to procure COVID testing kits. These are rapid test kits that can be utilized and help facilitate meeting these requirements and identifying potentially who amongst the workforce has COVID, so that you can help direct them to appropriate treatment, as well as to keep the rest of your workers safe. Job analysis. So part of developing a comprehensive pandemic preparedness plan is to conduct a task-based risk assessment that helps you to determine where you may be at, or where your employees may be at elevated risk of contracting COVID from one another. So as you can imagine, with what we know about COVID, those could be in indoor areas where people are in close contact with each other, working again within close contact, so less than 6 feet away, sharing common tools. So this is a step-by-step plan to help employers determine where there may be tasks that put their employees at greater risk. So again, as always, we have quick links available. So here's a quick link to the Agriculture Workers and Employers Interim Guidance from CDC and the US Department of Labor. We have our own Michigan-specific workplace safety guidelines, which are built upon the Occupational Safety and Health Administration guidelines for identifying low, medium, and high risk activities or tasks, and how specifically to approach mitigating those exposures. So if you're attending this webinar, you've likely walked through similar process in doing a hazard assessment for physical, chemical, and biological hazards, other biological hazards within your workplace. This is applying those same methodologies, but specific to COVID. So with respect to COVID, we would not expect within the agriculture industry that we would be beyond the low or medium exposure risk categories. So medium exposure risk are for jobs that require frequent or close contact, those within 6 feet of each other. This would be in individuals with unknown COVID-19 status, which could be other workers, as well as, again, for those public-facing operations, workers that come in contact with the public. Those who frequently travel to or work with individuals traveling from known international and domestic hotspots. And public-facing jobs, such as would occur with those working in food processing facilities and high-volume retail settings. Those of lower exposure risk, these jobs wouldn't require contact with those known or suspected to be infected with COVID, nor would there be a requirement for frequent or close contact, and that is defined as less than 6 feet of public and other co-workers. We then, again, along the right-hand side, start to describe mitigation strategies from using the hierarchy of controls. So from most to least effective. So we talk about engineering controls, administrative controls, use of personal protective equipment by risk level. So these are control strategies for low risk operations. And these are some control strategies that can be used for medium risk operations. And again, we walk through the hierarchy. So engineering controls always come first. So installation of physical barriers, increasing ventilation, your administrative controls, keeping customers and, for an example, and outside entities informed as to planned business practices. So let customers know what the expectations are before they show up to your business, if possible. Limiting access to the work site from outside entities and the public. Implement strategies to limit face-to-face contact. So use of drive-through windows, phone or internet ordering, curbside pickup. And then obviously, as we've all become aware of, use of personal protective equipment. But those things that we need to consider are factors such as function and fit, ability to decontaminate, disposal and cost. And exposures in this category are likely to require combinations of PPE. So one of the things that's very important when thinking about depending on your individual operations, use of face coverings, which is kind of a standard mantra that we hear about now. It is very important to know and to understand that face coverings are not considered personal protective equipment. And it is something that is important to know that use of face coverings for purposes of minimizing dispersion of COVID does not trump the required use of personal protective equipment like respirators for use during, say, spraying of chemicals like pesticides. So we have, again, in talking about fillable printable forms, created a embedded spreadsheet that allows you to list the jobs or the tasks that for which your workers perform, to list whether or not these are tasks that are performed indoors or outdoors, how many individuals are performing these tasks, what is the proximity, are they working greater than 6 feet from each apart, are they working less than 6 feet apart, does that task require the use of common equipment or touching of common surfaces? Again, this could be an indicator as to whether or not that activity, that task needs to be pulled into a cleaning and disinfecting protocol, or one needs to be developed surrounding that task. What is the PPE required under normal activity? So pre-COVID times, is there specific PPE required? And then now that we need to implement mitigation plans, are there additional exposure prevention measures that need to be implemented for this particular task? So do you need to increase distance between employees? Do we need to implement use of face coverings? Is there a need for additional PPE? So if individuals have to work closer than 6 feet from each other and physical barriers aren't available or allowable or possible, I should say, do we need to put them in face shields? So to try to help with some of this decision making, we put together examples of hazard assessments. So here are a team of workers and on a processing line. And so some of the things that you can ask yourself are, who is involved in this process? Is there a single person? Are there 2-person teams? Are there crews of staff? How often do they complete this task? Is this something that's done hourly, once a day, once a week? What is the task? Is it packing, picking, spraying? Are they handling animals? Are they directly interacting with the public? Where does this activity occur? Indoors or outdoors? Both? How? Are these workers working independently? Are they working side by side? Is there a brief interaction between workers, or is there extended interaction? Are they working side by side for several minutes or hours each day? Are they stationary? Do they have their own workspace, or are they mobile, walking around the facility? Is there a common use of tools? Are there common surfaces that they touch? And for how long does this occur? Again, talking about frequency. The entire shift, less than 15 minutes, over 15 minutes. So we want to identify those areas and locations and tasks that can be evaluated. So examples of those, because they may need a separate mitigation strategy for each. So for example, do we have shared housing, shared transportation? What about during check-in and while health screenings are being done, if that occurs on premises at your facilities? Break areas and lunchrooms, tool or supply storage areas, shipping and receiving docks, restrooms. This task is packing. So again, questions asked: indoors, outdoors, or both? How many employees? Are they stationary or mobile? Are they using common sets of tools and distancing? So right now, if you're looking at this particular operation, this packing operation, We know that they're indoors. There are many employees. They're all working in a stationary capacity. They are using common tools, and right now they're less than 6 feet apart. And they're working both adjacent, so shoulder to shoulder, as well as across from each other. So what are the mitigation strategies based on the responses to some of these questions above that may be acceptable? So, you know, they're indoors, so you can think about increasing ventilation, which is an engineering control. You can do that by opening windows and doors and or increasing the number of air exchanges using fresh air per hour. We have multiple employees and stationary work, so we need to improve distances if possible, which is an administrative control. If we can't change the distances between workers on a given line, can we implement some administrative controls like start shift work? Can we install physical barriers like plexiglass, which is another engineering control? Or do we need to use PPE? Common use of tools. Is it possible to purchase separate tools for each employee so that an employee has a set of tools that they can use for them on their own or by themselves for a given shift? And then those tools be cleaned between their shift and the next. So we've also provided some examples of configurations that may be modified. So the current configuration for this packing line is something like this. Here's the table. You've got individuals working side by side and across from each other with less than 6 feet of distancing. Is it possible to extend the length of that table and have individuals working side by side? Now, granted, they're less than 6 feet apart, but maybe we're able to either hang or put on poles plexiglass between workers. Or perhaps we're able to increase space between the individuals. So now we've got individuals working side by side, but they're greater than 6 feet apart. And they're staggered across the table. And we've hung a length of plexiglass along the middle of the table, the center length of the table, so that individuals are protected from those across from each other. So those are just some examples that we've pulled together, and we're updating and including additional examples all the time that can be used as a starting point to develop mitigation strategies that work specifically for your operations. Then finally, last but certainly not least, has to do with the requirements under employee training. So comprehensive and effective training program aimed at the prevention of disease spread among and between employees is a requirement. So what do those training programs need to consist of? So they need to consist of an overview of COVID and how it spreads. If people don't understand how the disease is spread, it's difficult for them to implement mitigation programs aimed at preventing spread. They need to understand what new activities or procedures aimed at mitigating exposures to COVID-19 are now in place. So things like health screenings, what are the policies for sick workers, including support, whether that be medical or financial, who to contact if they're experiencing symptoms while at work, when to return to work. So we linked to that return to work document from CDC that describes at what point individuals are able to return after their symptoms have resolved or are improving. Operation-specific training. So are there new requirements that would allow for social distancing? Have you put mats on the floor that designate where people stand along, say, a packing line to help them remember to stay 6 feet apart? additional hand washing and hand sanitizing stations, the need for the use of face coverings, new cleaning and disinfecting, sanitizing protocols, and who's responsible for those, how to safely work with the public. So communicating new policies such as telephone ordering, web ordering, again, cleaning and disinfecting countertops, credit card readers. Task or job specific training, so changes in their work practices. Are there changes in your shipping and receiving operations? Again, cleaning and disinfecting, physical changes to work sites due to COVID-19 procedures, such as increasing distances, changing orientation between workers, using barriers. Is there a need to use additional PPE like face shields? And then importantly, there needs to be an acknowledgement of training. They need to recognize that they have received this information and that they will follow new procedures. So again, along the right-hand side, we have useful links. So workplace requirements by MyOSHA, which follow the OSHA requirements. We have editable forms that help. If people would rather develop pandemic preparedness plans in Word documents, they can do that. So here is a template for a Word document that would satisfy the requirements for a pandemic preparedness plan. We have sample employee training presentations. So this PowerPoint presentation hits all of the requirements that are required for training under the requirement for a pandemic preparedness plan. And so operations can take and download this template, insert their company logos, insert business names, name of the trainer, date of the training, names and contact information for the COVID-19 prepared responsible individual. It provides the information as to how COVID-19 is transmitted, steps to protect workers and the public. And again, these items on green are placeholders for operations, business owners to insert their business specific information or operation specific information. We have templates in place, again, modifiable templates in place for notification if an employee tests positive. We have sample templates for facility cleaning. So here is a cleaning and disinfecting protocol. You can insert your business or operation name and then modify this as necessary to meet your operational requirements. We have, again, sample templates for using face covering. So again, insert your business name here, how to effectively wear a face covering, and then how not to wear a face covering. So again, the whole goal of this downloadable workbook is to help give you the tools that you need that are modifiable, readily usable, to be specific to your workplace. And then make sure that by the time you've worked your way through it, that you have a written pandemic preparedness plan that is in place that you can use, not only for COVID, but, and I say this, hopefully there won't be another pandemic that occurs in the next 100 years, but in the event that it does, you already have a program in place. Finally, the remaining tab, the last tab, is for additional resources. So we have, and this is updated regularly, links to templates, to videos that have been translated into multiple languages, printables, posters, banners that will help you get your facility set up and appropriately equipped with respect to communications and marketing, communications with your employees, marketing to your customers. So again, we have links for shared and congregate housing, checklists for ag employers, toolkits for meat and poultry processing facilities. Again, multiple languages that these videos and posters and printables have been translated into. We have some commodity specific links. So here's one to the United Fresh Produce Association, specific to coronavirus, farmers market associations, and so forth. So that is what I have for you today. Again, we are taking this right now and turning this into an online downloadable database that can be used not only for COVID, but will be able to use for developing health and safety programming for your operations as well. There will be a mobile application component that will be developed, and we will be able to, through this new technology, extend reach beyond what we've done now. So with this pretty simple Excel downloadable tool. So I guess I'm open. I'm going to stop sharing, and I'm open for any questions that you may have.
Well, thank you so much, Dr. Millerick-May, for sharing the CHAMP-E tool and all of those resources that were there. I just want to open it up for questions. You can use the chat box to put those questions in at this time, and just kind of type them in. We'll give everyone a few moments to think about what you might want to ask, or just any comments that you might have, maybe things that might be relatable to you and your industry. I guess I'll just kind of get things started. So you did mention that you're going to be turning this into a mobile app, and then some of those resources there at the end, you'll have those available for in a web version. But I guess what's the easiest way for people to access the information right now, whether it's in the Excel doc or anywhere else?
Yeah, so that's a really good question. So this is available at the Michigan State University Rapid Response for Agriculture webpage. And what I will do is I'll pull that up and then share my screen again.
Sure.
And I'll include the link in the chat. Oops. Okay, so there's a link.
Yep, and I'm just gonna copy. So I just put the link in because I think you had initially sent it to just the panelists. So I think everyone can see the link now,
Okay.
but it's up there now. And I'll be sure to include this link also in the follow-up email that goes out to everyone that registered.
Here is, and if you could, maybe I'll do it as doing it for all panelists. This is a more direct link. The one that I utilized before had an article that went along with it. So this is a more direct.
Okay. Yep. So it's in there now.
Okay.
Yep. So there's the link. So for those of you on, feel free to click through that and explore it. And like I said, I'll include that link in the follow-up email as well. Any other questions from our guests today, or comments? And Dr. Millerick-May, any other last thoughts? It looks like I haven't seen any questions come in. So any other last thoughts before we sign off for today?
I don't think so, other than just stay tuned. And we're really excited, not only for with the use of this tool, but for the development of the new tool that's underway, because again, that will cover all aspects of farm safety and health and include modules and submodules, not only for pandemic preparedness, but also for things like emergency planning, hazard communication, and so forth. So it'll essentially be a one-stop shopping approach to all things health and safety.